you today?
I'm good. How are you?
I'm good. My name is Erin, and I'm going to be your nurse today. And I heard you were newly diagnosed with type 1 diabetes. Is that right?
Yes.
Okay. And has anyone come in and explained what that is to you?
No.
Awesome. So I'm just going to give you a brief synopsis of what diabetes is and what's going on inside your body. So there's two types of diabetes. There's diabetes type 1 and type 2. You were diagnosed with type 1. So what this means is there's excess glucose in your bloodstream. The excess glucose is due to your pancreas not releasing any insulin. Insulin's job in the body is to take glucose from the bloodstream and put it in your cells so that your body can use it for energy. So when you have no insulin, this means there's no glucose in your cells, which means your body can't use that glucose for energy, and there's too much in the bloodstream. With type 2 diabetes, they have insufficient amounts of insulin released from the pancreas. So they may require insulin and they may not require insulin. Do you have any questions about that?
No.
Okay. So, like I said, you were diagnosed with type 1 diabetes, which requires you to take insulin in order to remove that glucose from your bloodstream and put it in your cells. So, when you're taking your insulin, it's important to know the different types of insulin you're taking and their onsets, their peaks, and how long they're going to last in your body, so the duration they're going to last. I'm going to teach you about two types of insulins. In particular, we have rapid acting and long acting. And I'm going to give you this handout before you leave, so don't feel like you have to memorize everything that I'm telling you. It's going to seem like a lot of information, but just to get it in your head. So first we have rapid acting insulin. So this is typically used right before you eat your meal, so you don't have a spike in glucose levels after you eat. So the onset of this medication, which means when it starts working in your body, is 5 to 15 minutes. The peak is 1 hour, so that's when it's at its strongest, and it lasts in your body doing its job for 2 to 4 hours. Then we have our long-acting insulins. So this will help control your blood sugar levels in between meals and also at night. This medication doesn't have a peak. It just lasts for about 24 hours in your body doing its job. Do you have any questions about that?
No.
Awesome. And like I said, I'm going to give you this handout so you'll have that to use when you go home.
Perfect.
Awesome. So have you ever given yourself a shot before?
No.
Okay. So with insulin, typically you have to give yourself a shot. If you feel like this process gets too arduous, there is an option of an insulin pump, which will automatically give you the insulin. But for now, I'm going to go ahead and teach you how to give yourself your subcutaneous shot for your insulin. So we're going to pretend like this is our needle and this is your skin. So what you want to do first is you're going to have an alcohol swab and you're just going to wipe where you want to insert the needle. You're going to uncap your needle and you're going to go in at a straight angle. You don't want it at 45 degrees, you want it right at 90 degrees, and then you're going to pinch your skin up, and then you're going to insert the needle and insert your insulin. You can hold it there for a few seconds, and then you're going to take the needle out and unpinch your skin. And then you can go ahead and hold pressure for 5 to 10 seconds until it stops bleeding. So, do you have any questions about that part?
No.
Okay. So some common places that people inject insulin is the abdomen, back of the arm, and the outside of the thigh. When you're giving yourself insulin each day, it's important to rotate the site about an inch just so you're not inserting the needle into the same spot every single day, because that could cause tissue damage. Any questions?
No.
Okay. All right. And I know I've been talking a lot about insulin, so moving on to the next topic is monitoring your blood glucose levels. So this is super important when managing your diabetes because your blood glucose level is going to fluctuate. So it might be high at one time, it might be super low at one time. So it's important to monitor your levels throughout the day. So just some important times to check your blood glucose are before meals and snacks, before you exercise, and before bed. So something about exercising, you definitely want to check it before you exercise because When you exercise, you're actually more prone to become hypoglycemic, so a low blood sugar. So you may need to reduce your dose of insulin or maybe not even take the insulin if you are working out. And also during your workout, it's important to keep a little bit of a snack just to keep your blood glucose levels within the normal range. Any questions about that?
No.
Okay, and have you ever had your blood glucose drop below 70?
No.
Okay, so if this happens, what I would recommend is drinking something like orange juice, chewing on a hard candy, or maybe even taking a glucose tablet. After you do this, I would wait about 15 minutes, recheck your blood glucose levels, and continue checking your glucose until it raises to within the normal range. And if it doesn't do this, I would contact your healthcare provider. Okay, any questions?
No.
Okay, so what does your daily diet look like?
I wake up, eat yogurt, and then I normally go out to a fast food restaurant twice a day.
Okay, so I love what you said about eating yogurt for breakfast. That's great. Even adding in like some protein like eggs into your breakfast would be great, or adding some fruit to your yogurt.
Okay.
And I noticed what you said about eating out twice a day, and I know it's super convenient to eat out, and it's super tasty, but just some foods that you might want to stay away from are processed foods that have a lot of like saturated fat, trans fat, high cholesterol, high sodium, because managing your diet is a huge part of managing your diabetes. And like I said, some foods that you may want to increase or include in your diet are fruits, vegetables, whole grains, beans, low-fat dairy products, and fiber. Do you have any questions about that?
No, I think I got that part.
Awesome. And then lastly, we're going to talk about foot care. So as your disease progresses throughout your life, you may begin to lose sensation in your feet. This is something that we call diabetic neuropathy. So it's super important to check your feet daily for anything like cuts, abrasions, bruises, anything that may cause an infection. Do you have a spouse at home that may be able to check your feet at night?
Yes, I do.
Okay, awesome. And that might help just because she can probably see more than you can look at the bottom of your feet for you. So like I said, important to definitely inspect your feet daily. Just some tips about protecting your feet. Try to wear closed-toed shoes when you're out to prevent you stepping your toe accidentally or something falling on your foot and cutting it. I definitely want you to keep your feet moist with lotion, but try not to put the lotion in between your toes because this could build up and cause infection. And when you are cutting your toenails, I definitely want you to cut your toenails. Keep them short just so you're not accidentally cutting your other foot or anything like that. Just use caution when you're doing that, not to cut them too short or nick yourself. And also, before you get into the shower, make sure the water isn't too cold nor too hot, because since you may have decreased sensation in your feet, they may not be able to feel the temperature. Any questions about that?
No.
Awesome. And last thing I want to talk about is something we call a medical alert bracelet. So with diabetes, it's important that if you're ever in a car accident or an emergency, you are wearing this, which will tell the healthcare providers that you have diabetes, which can help plan the course of action in order to treat you properly. So I'll give you this, and I'll also give you your handouts to take home with you. Do you have any other questions for me?
I do not.
Thank you.
912.
That's fine.